Have y'all seen this? Let's do a little switch up, shall we? Welcome to She Knows DNA. My name is Mia Bana, and I am a board-certified genetic counselor. So today I'm going to switch things up just a little bit because, yes, there is all types of conditions out there for me to teach you all about, but I hope that today's is going to be more realistic and helpful for those that may encounter a genetic counselor. So with that being said, let's get into it. Here are 5 things you should do before attending your genetic counseling appointment. Number 1, please make sure you ask your referring provider why it is that they sent you to a genetic counselor. Times and times and times, which too many to count, let's be honest, have I seen patients, whether it is in my current clinical setting or even throughout all of my education and rotations and things, do I find that some people have no idea why they are getting genetic counseling. And that can be very scary, especially when they're sitting in front of me like, why am I here? And so please make sure you, as a patient, make sure that you are asking that referring provider, great, why are you sending me there? Is something wrong? Is there something different? Is there something I need to be prepared for? Talk to them first. Number 2, ask your family members about their medical history, okay? That is not something that, we usually talk about. I don't go up to my Uncle Bob. I do not have an Uncle Bob, I don't think. I don't go up to my uncle and be like, hey, so tell me, how's your health? I know it can be taboo, especially in certain cultures, but that is super important because during the genetic counseling appointment, one thing I am going to ask you is not only your personal health, but your family history, because we're talking genetics, meaning that there can be things inherited, and also meaning that there can be some patterns I can pick up on and be able to better help and assist when it comes to any additional risk on top of why you're there already to see me. And really, this can be number 2, part B, men, go to the doctor. It's always whenever I asked about the women in the family, they're like, oh yeah, there's this, this, and this. I had my physical here and everything was good. And then here come the men. I don't know. I feel good. When's the last time you went to the doctor? Do you know your blood pressure? Do you know if you have diabetes? They do never, they never go to the doctor. And so it does not help me whatsoever. If I have to rely on just the men in the family to try to pick up anything, baby, I would be out of a job because they know nothing. They know nothing. They do nothing. Number 3. So if you do know why you're going to see a genetic counselor and you decide to turn to Dr. Google before you go to that appointment, please just take the information that you see on there as for a grain of salt, basically, because all of the things that pop up whenever you search something is going to give you the worst of the worst. And plus, there's a lot of misinformation out there. So yes, you can Google, because I know I do that too, but also just know that whenever you do come see a genetic counselor, that we will give you the real. So again, take it with a grain of salt, but also based off of what you read, if you have questions, write it down, because I'm going to make sure by the time you finish with me that you have the accurate information and accurate resources to pass along to other family members. Deuce, is you okay? Why you whining? Number 4, choose wisely who you decide to bring with you to the appointment. Having that support there and someone that can, listen for you or that knows you and that's taking the information can be great. But there's that difference between that guest there who's being helpful, and then on the other end, they are just doing the most and they need to get up out that room. Even if that partner or that person that's with you at the appointment is, you want them to kind of take control, you as the patient are still the patient, the main focus. And so part of my job is to make sure that you do have your own autonomy and that you yourself are the one that's making the decisions. Even if it's a thing of, okay, you brought your auntie and she said you should do this, well, I still need to hear that from you, the patient. That way, I'm making sure I'm meeting your needs and things, and also documentation wise to make sure this is actually what you wanted, because y'all not gonna sue me. Number 5, as a genetic counselor, one of the things that was a part of my training, of course, is being able to read and interpret and give recommendations or give more information based off of said genetic testing results and the labs of them. And so not only what it means for you, what it means for family members, what it means for management, treatment, no treatment, how that impacts your family. There is not one test that could tell you everything about your genetics, technically, especially anything that's valid. I don't want people to read them and then take medical action or have medical anxiety and whatever that is without someone reading them or without there being a clinical grade type of lab to test for whatever it is. Here's an example, because I'm a genetic counselor. I know how to read genetic reports. Okay, my genetic counselor self, I had a doctor's appointment, and of course, with my chart and things like that, I could see my results. Okay, now I didn't have genetic testing, right? I had regular lab results. Based off of my interpretation of it, I had lupus. I said, oh my Lord, I'm calling people, I think I got lupus. I go to my doctor's appointment to where she interpreted and told me the results. I definitely don't have lupus. So, genetic reports are very complicated. I don't want y'all to think that you have a genetic condition or something scary, or whether you're a baby or something. I don't want you to think that until someone that's trained to look at it looks at it. I just don't want y'all to be me, the genetic counselor who diagnosed herself with lupus that actually does not have lupus, meaning that I need to stick with genetic reports rather than those other lab reports, because I don't have lupus, even though I thought I had lupus. I know I said 5, but let me give you a bonus one, okay? Number 6. Genetic counseling is so unique. One of the things that we take pride in is listening. One of the first questions I ask you, like, tell me your story. Tell me how you got here. You know, fill me in from your front. I listen, and then I take that information based off of everything you told me, based off of the records, based off of the genetic testing, or me collecting history and bring it all together, and then I advocate for you. But yeah, I know at the end, you're going to be not only fascinated with genetic counseling, but fascinated with me, because baby, one thing I know about me is I'm good at my job. And I like that. God gave me a gift, God gave me a vision, and God gave me, my mind and my mouth. And after I see my patients, the things they say to me, even whether I've told them terrible news or not, the reactions and the feedback I get lets me know that God's got me and I am exactly where he needs me to be, even in their life. And he gives me the words to say. Again, you're never going to meet somebody like me. So be excited. That's number 6. Be excited to see Mia Vanna, the board certified genetic counselor. Okay. And now to leave you with words of wisdom. So, I just had a birthday. I'm 30 years old. So the wisdom I have to give to you is you better prepare your minds, your hearts for me. Huh? I'm 30 now. 20s tried to kick me like real bad. My 20s tried to take me out in the most literal sense. But God. Sorry. I'm a church kid. I love him for real. It would be wise for you to continue to watch my videos, to learn, to ask questions, to share. Okay? That's the wisdom. That's the wisdom. Well, y'all, that really is all I have. I know this time around with this season of She Knows DNA, it is going to be a little different. I'm going to just tell y'all straight up, I don't know if I'm going to post on Tuesdays or Wednesdays. Or, I don't think I can tell you a date because that's how life is just going right now. However, I am going to post at least one of these videos once a week. I want to be consistent because I know I love this channel. I love She Knows DNA, and I know you guys love it too. And so we can work together. Just know that the videos coming. They are coming. If it's taking too long, watch one of my older videos. Reshare that, until I post one. But I promise y'all, I am going. We own this. We good. We gonna keep going. Okay. Please feel free to like, comment, share, subscribe, all the things. All right. If there's a topic you'd like me to cover, please let me know. And otherwise, I will see y'all next week. God bless you. May he keep you and continue this journey with me. All right. Don't worry, Deuce is here. Deuce is here. All right, y'all. Bye. Also, it's true. The weather turned and my knees hurt. My joints hurt. I guess this is 30. I'm in pain. I sneeze and sometimes I feel like I'm gonna pee a little bit. And that sucks because I haven't even had children yet.